The nation's top doctors testified on Capitol Hill Tuesday as parts of the country see a spike in coronavirus cases and hospitalizations. Naomi Ruchim has the latest.
The nation's top health experts are calling the surge in coronavirus cases disturbing.
We were going down from 30,000 to 25 to 20, and now we sort of stayed about flat, and now we're going up. A couple of days ago, there were 30,000 new infections. That's very troublesome to me.
25 states are reporting an increase in coronavirus cases in the last 2 weeks. On Capitol Hill Tuesday, Dr. Anthony Fauci said he's concerned about community spread.
The next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states.
In Texas, hospitalizations rose nearly 60% in the last week. Governor Greg Abbott warns shutting down the state is not out of the question.
If those spikes continue, additional measures are going to be necessary.
The spike is putting frontline workers at risk.
I was kind of hoping, maybe it's just a cold or something.
Kayla Cordova, her brother, and parents are all nurses in Texas. They all got the virus.
A lot of people need to take it seriously. I don't wish this on my worst enemy.
Myrtle Beach, South Carolina is another hotspot. Cases are spiking sharply as tourists visit.
Oh, we're having fun, not worrying about it, and enjoying the weather.
Dr. Fauci praised New York, which had been the epicenter of the pandemic, for following the task force's guidelines and bringing cases down. The city has made so much progress, it entered phase 2 of reopening Monday with outdoor dining available. Barbershops and salons have also reopened with strict guidelines. City officials say phase 3 of reopening could happen in a couple of weeks if the numbers keep going in the right direction. Naomi Ruchim, CBS News, New York.
Dr. Qanta Ahmed joins me now. She's a visiting fellow at the Independent Women's Forum and an intensive care specialist at NYU Langone Medical Center. Welcome, Dr. Ahmed. Thank you for joining us. What are your takeaways from Tuesday's hearing?
So I listened to it at length and did not learn much that I did not know. Here, of course, in New York, we've had the very sharp end of the spear with this pandemic. And I was disappointed that the experts did not focus more on contact tracing and tracking, which will then guide tailored quarantine. We know this virus can transmit and is contagious. We know that it transmits asymptomatically. We also know that states which instituted very severe immobilization of the population, face masks, hand hygiene, and other precautions are responsible for the biggest fall in cases in the United States, which seemed to show national rates were dropping. Now, of course, we're down to about maybe 39 deaths, all of them tragic, in New York a day. At our peak, we were at over 1,000 deaths a day. So that national reduction in numbers was due to our efforts in New York and New Jersey and Connecticut. The rest of the country has been very slow to take up these recommendations. So this is very concerning. The other thing missing from the testimony is, of course, public health officials want a vaccine, as do I. I will be taking it when it's available. Of course, they want us to observe social distancing and hand hygiene and so forth, face masks. But they're not speaking about the massive indirect costs of this kind of paralysis. I've heard of patients this week whose cancer spread during these 3 months so that it's now inoperable. I've heard of children developing anxiety disorders because of the isolation. We are going to have also many psychiatric disorders. I heard of 3 suicides this week through my patients and colleagues. So there is an enormous cost to paralyzing us as well, which was also not discussed.
Well, a number of states, especially in the South, are seeing both an increase in the number of cases and the number of hospitalizations. What do the task force members attribute that to?
I think that there is a natural spread of disease. There is a misapprehension that we can really contain this pandemic. The organism is already disseminated in our population. We are going to continue to see transmission. But 3 states in particular, Florida, Arizona, and Texas, they have not necessarily emphasized very basic things like the wearing of face masks, which tragically has become a politicized action in the eyes of many. And that has lost them time. They're not solely to blame. We had an inordinately poor response nationally to making testing available. So that when I was managing patients in the ICU, the critically ill and the hospitalized were almost the only New Yorkers that could get tested in the beginning. These other states have had testing widely available, but have not been able to roll it out on massive scale or have the contact tracing and tracking. Elaine, that's the most important. This disease is still traveling in our communities, is still infecting young people. We heard of an international tennis star today who's been infected. What we need to do is identify who's infected, who they've been in contact with, and quarantine them too. And we need an army of public health workers for that. We have almost 45 million Americans out of work now. Let's recruit 1 million of them to become contact tracers. That's what we need, household to household intervention. None of that was discussed in the testimony.
We mentioned Texas, which is seeing an increase in cases and hospitalizations for people under the age of 30 in particular. What does that suggest to you?
Well, we know that no one is immune from contracting this infection. We know even little children are often vectors for this transmission. What isn't said so much, and what's alarming about Texas, is they're seeing not only more cases, but more hospitalizations and more intensive care admissions and more ventilator usage. Texas Children's Hospital actually opened up to adults to cope with, to provide some surge capacity. But it's not explaining that many of the people in Texas who are being infected will themselves resolve the infection. If they are quarantined while they're resolving the infection and well at home, that's safer for everyone around them. But we are now seeing these cases, which are the product of transmission 2 or 2.5 weeks ago. So we can see 2.5 weeks from now, Texas will be reporting higher death rates. And that's what's very concerning.
You mentioned treating patients in the ICU, and as I understand it, you've been treating patients with COVID-19 since the very start of this outbreak. I wonder, have you made any changes to treating patients? And if so, how have those treatments sort of evolved based on emerging science of this?
So to be very clear, I've completed my duty in the ICU after 2 months in the pandemic, about 3 weeks ago. So I'm not actively treating critically ill patients today. But what we saw through the course of those 2 months was that we initiated everybody on hydroxychloroquine and Zithromax at the beginning. By the end of the 2 months, we were more discriminating about who was receiving both of those medications. And we also developed a greater use of steroids. In the beginning, we were not using steroids. Now it's considered that steroids, Solumedrol or dexamethasone in particular, could be very beneficial for these patients, something that we've known from viral pneumonia all along. In the beginning of the pandemic, when I began in March, there was no convalescent plasma available. Now we have many Americans who've been exposed and will develop antibodies, and convalescent plasma is also available. And finally, when I was starting in the ICU in this pandemic, we had no remdesivir available except for compassionate use. Now remdesivir is more widely available, the antiviral, in intravenous form, and Gilead Sciences is announcing that it's trying to pilot it in inhaled form. So those doctors that are managing the pandemic in Texas and Florida and Arizona, where the cases are rising, will have more treatment options and will also learn from our experience. But what makes us very concerned as critical care physicians here in New York is that the rest of the country does not yet grasp how grim and how grave the situation is and how rapidly it can decline. So we're very fearful. When we were dealing with it, we did not know what was to come, even though we had the Italian experience to a degree. It certainly exceeded any of our expectations. We had more disease and more death and more suffering than even in Milan or Wuhan. New York has had over 30,000 deaths now. That's almost a quarter of all America's deaths in this pandemic. So we don't want to see that happen in other states. And that's why their measures need to be stringent, both in the hospital, but also in community-wide mitigation.
And hopefully that message is spreading even as this outbreak continues. Dr. Qanta Ahmed, thank you very much for sharing your perspective and insight with us. We really appreciate your time.
Thank you so much, Elaine.